there are a couple of concepts I'd like to talk to you about when you're receiving manual therapy. And one of them is what I call the layers of tension, or the layers of the onion. Because if you come and see a chiropractor and you've had difficulties with your mechanical function in your muscles for some time, it may be linked to several injuries or postural bad habits that you've had over many years. When we start working on this, as chiropractors, we like to get to the bottom of the problem and the root of the problem. It may be that your pain and your symptoms may vary through that process. It may hurt a little bit here and may hurt a little bit there, and then it get better and better, but then something else might hurt a little bit before that gets better. And that is because we're taking the layers off all these compensation patterns that you may have adapted over the years. And it's absolutely normal. And it really is about trying to help you get down to the root cause of the problem, rather than putting a plaster on top of it and ignoring everything that's underneath, all the iceberg that's underneath it. The other one that we talk about, and that I coined, the transistor radio effect. That is that you may have been to a chiropractor before and you noticed that you came in with shoulder pain. And it hurt all over. It was quite vague. It was in several areas, of quite a big, large area. And the chiropractor will do the case examination and the case history, and they will treat you. And after a couple of treatments, you'll come back to the chiropractor and you will say, well, it hurts more sharply now. It hurts more. Why is that? How can this be right? And the chiropractor will then explain to you that when you came in, it was hurting all over. And probably, and most likely, what happened was that you had an injury to one area of your shoulder. That was the original area. And initially it hurt a lot there. But then to protect you and to adapt to this, your body automatically created protective tension around it, in front, above and below. And you probably started moving your shoulder more stiffly than you did before, to protect it and to avoid the pain. And this is just like the transistor radio in the old days, not the digital radio that we now have, but the old transistor radio, that you have the dial and you're trying to get the right channel. And initially it's quite, the noise is quite, how can I say, it's unspecific. And it's quite loud and irritating. And then suddenly you get the right channel and it becomes sharp. And it's a little bit the same thing that happens with your shoulder, that it goes from messages from the muscles all over, going up to your brain, you're perceiving it as pain all over, to we're getting rid of some of, and we're helping to realign the areas around it. And then we're getting into the original cause. And you will have only messages from there. Clearer, more crystal clear messages from the area of the original injury before that heals and gets better. And that's what we call the transistor radio syndrome.